You have a presumed diagnosis of a superior labrum anterior to posterior cartilage tear in your shoulder, otherwise known as a slap tear. Now, this is a really interesting condition that occurs in all ages as an MRI finding. It's important to understand that the most common patient who has a symptomatic cartilage or slap tear of the shoulder is an overhead athlete, such as a pitcher or a thrower, or a swimmer or a volleyball player. It is much less common for an individual in his 30s or 40s to have a clinically important cartilage abnormality such as a slap tear in his or her shoulder. As we age, abnormalities of the superior labrum will appear on MRI. Even more importantly, we know that even in our highest level athletes, such as Major League Baseball players, when they have labral abnormalities or cartilage abnormalities on MRI, we still allow them to play without limitation. If they get symptoms, not all of them will require surgery. Treatment for some superior labrum anterior to posterior or slap tears is often non-surgical. There is no evidence to suggest that these will progress with continued participation in sports. So we're treating the here and now, the pain and dysfunction associated with the diagnosis of a labral tear. So if you have a labral tear, we might suggest physical therapy, sometimes a corticosteroid injection, or maybe short-term limitations in your activities. If it requires surgery and you are a relatively young patient who participates in overhead sports and swimming and so forth, it might require labral repair. If it requires labral repair, your recovery times can vary between 4 months and 6 to 8 months depending upon the nature and skill level of your sport. If you are an older patient who has a superior labrum tear, it often does not require surgery, or it may not even be the cause of your pain at all. In fact, most patients who have labral abnormalities on MRI over the age of 30 will have some degree of biceps tendon involvement, and that too can be a potential pain generator. Patients in the older age group who have labral pathology and fail non-surgical care can often be treated by surgery, but it's less commonly performed in the setting of a labral repair, and more commonly it involves fixing something else, which might include the biceps tendon. If it's your biceps tendon, that might require a procedure called a Biceps Tenodesis, where we release the biceps from the labrum and fix it in the front of your humerus. That's an operation that can maintain the cosmetic appearance of your arm and maintain the strength over time. We will discuss these things in the office in the course of deciding what the best treatment is for you and your labral tear.